is Olivia Varnish. I'm a student nurse at Marine Valley. Is it okay if I do a full head-to-toe assessment on you? I'm going to start off by checking your wristband. Could you state your name and date of birth? Okay. Could you state what day it is right now, who the president is, where you're at right now, and why you're here? Patient is orientated to person, place, time, and situation. Patient's speech is clear. Patient's grooming is well kept, is shaved and hair styled back. And patient uses no assistive devices, is independent, no involuntary movements, no signs of distress. Patient is a middle-aged man. Facial expression is relaxed, behavior is appropriate. Shape and size is symmetrical bilaterally. Now I'm going to do your vital signs. I'm going to start by listening to the apical pulse for 1 minute. It's the 5th midclavicular intercostal. I'm just going to pull it down now. Okay, patient's apical pulse is 80 beats per minute. Normal is 60 to 100, plus 2 normal and strong. Now I'm going to do your radial pulse and compare it to your apical pulse. Okay. Patient's radial pulse is 82, normal 60 to 100, it's plus 2 normal and strong. I'm going to check your blood pressure, and the cuff is 1 to 2 inches above your elbow, and feet are uncrossed, arms are at heart level. Your blood pressure is 120/80, which is in normal. Your respirations are 16, normal is 12 to 20. One respiration is 1 inhale and 1 exhale. Your oxygen saturation is 98%, normal is 95 to 100%. You're on room air. Your temperature was measured orally under the tongue. It was 98.6. You could also do it temporal on the forehead. I wouldn't do this if you just got out of the shower. Axillary in the armpit. Tymanic in the ear. I would not do this if you just had an ear infection. And my last resort would be rectal. I would not do this if you're unconscious or had a recent rectal surgery. So all your vital signs are normal limits. Now I'm going to inspect your head. Any pain or discomfort? No masses, no tenderness. Face is round and symmetrical. The lips are moist and pink. I'm going to check your scalp. There is no lice, no bugs, no redness, no peeling found. And your hair is attached to your scalp. No signs of hair loss. Hair is brown, clean. Your eyes are equal. And your eyebrows are present above your eyes. You can choose my pen light. So conjunctiva is clear, sclera is white. Your eyes are perla, equal, round, reactive to light, and accommodating. I'm going to check your EOMs, which is keep your head still and follow the pen light.
What?
Okay, so patient is able to follow the pen light. eyes are equal and both following at the same time. I'm going to check your nose, and it is centered and equal. No flaring, no patency, no septal present. I'm checking your ears, the tragus, the pinna, and the lobel. Any pain or discomfort, no drainage, no lesions. And I'll check the other ear, the tragus, the pinna, the lobel. Any pain or discomfort, no drainage, no discharge. And I'm going to check your mouth. So teeth are white, intact, no signs of decaying. Lips are moist and pink. The uvula is midline. Hard palate is firm and white. Soft palate is smooth and pink. Tonsils are absent. Gums are moist and pink. Buccal is pink. I will also check for dentures, signs of decaying, and loose teeth. Okay. I'm also going to do the whisper test on you to make sure you can distinguish between a normal voice and a whisper voice. 1, 2, 3. 1, 2, 3. So, patient is able to distinguish between my normal voice and when I whispered. So I'm going to check your do your lymph nodes. So pre-auricular, post-auricular, post, occipital, tonsillar, mandibular, premental, anterior cervical, posterior cervical, and supraclavicular. Okay, now, so your face is round and symmetrical, your shoulders are even, your trachea and substernal notch is midline, and neck is symmetrical. Now I'm going to be doing some range of motion on your neck, so have you flexion, extension, your neck, and have you turn up, down, left, and right. And I'm also going to have you do it against resistance while I hold your neck. So patient is able to do all range of motion for putting their head up, down, left, and right. And patient could also do it against resistance. And skin is dry, warm, and intact. Now I'm going to start off by palpating your chest, and I'm going to move this down. So patient uses room air. No accessory organs are used. No involuntary movements. Patient has no coughing, no sputum. Patient has no trouble, difficulty breathing. I'm going to be doing some inspecting of your upper and lower extremities. Any pain or discomfort? Okay. No tenderness, no masses found. And check your nails. The nails are brittle and the skin is dry, warm, intact. Doing capillary refill on each finger. Less than 3 seconds. 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 less than 3 seconds, less than 3 seconds, less than 3 seconds, less than 3 seconds, and less than 3 seconds. Patient had no pain or discomfort, and now I'm going to be palpating your 5 cardiac landmarks. So I'm going to start with the aortic, which is the second intercostal right of your sternum. Okay, and then pulmonary, which is the second intercostal left of your sternum. Erb's point, which is third intercostal. Tricuspid, fourth intercostum, and the fifth intercostum is apical/mitral. It's midclavicular. Okay, so no pain or discomfort is noted. I'm also now going to be checking some pulses. I'll be starting with the radial pulse. So it's +2, normal, strong. They are symmetrical, equal bilaterally. Doing the femoral pulses. They are +2, normal, strong, equal bilaterally. Okay, and then the popliteal pulses under the knees, +2, normal and strong, equal, symmetrical bilaterally. Doing the posterior tibal pulse, +2, normal, strong, equal, bilaterally. Okay, now I'm going to use the ladder technique to listen to your lung sounds. And doing this laterally. And I would also do this posteriorly. And lungs are clear, no signs of wheezing, no signs of crackles, no signs of distress. Now I'm going to listen to the 5 cardiac landmarks. So the aortic, which is the second intercostal, right of the sternum. Pulmonary, second intercostum, left of sternum. Erb's point, third intercostal. Tricuspid, fourth intercostal. And apical/mitral is the fifth intercostal midclavicular. Okay, so no pain or discomfort. Patient is able to breathe in a supine, pine, and upright position. Now I'm going to be checking your abdomen. So abdomen is flat and symmetrical. The pigmentation, color is appropriate for you. No scarring, no broken blood vessels, no stretch marks, no masses, no bulges, no pulsations, any pain or discomfort. And the euplonicus is midline. I'm going to be checking your genitals. So tissue is healthy, no discharge or lesions present. Patient urinated 1 hour ago, it was yellow and clear. Patient had a bowel movement 2 hours ago, it was normal, brown stool. Now I'm going to listen to the abdomen, starting with the right lower quadrant. And then the right upper quadrant, left upper quadrant, and left lower quadrant. So patient's bowel sounds are normal, active. And now I'm going to palpate and Is there any pain or discomfort? Okay. No masses, no tenderness found, no pain, no discomfort is found. You pull your gown down, and now I'm going to be checking the upper and lower extremities. Any pain or discomfort? So no mass is found, no tenderness, no crepitus. Patient's gait is even, no tics, no tremors. The Romberg balance is negative. Patient's muscle is equal bilaterally. I'm going to be using my pen light to check your muscle and to see where you feel it. Okay. So patient said left knee, they felt a strong, sharp pain. And then the patient said right elbow. Patient said right knee, they felt a strong sensation. Now I'm going to be checking your strength, so I'm going to have you squeeze both my hands. Okay, so patient strength is equal bilaterally. And have you push down. Patient strength is equal bilaterally. And we did your JVD test earlier by placing you in a supine position, placing you flat. And when we checked your pulses, they went away at 30 degrees. This is going to show you that you are negative for JVD. And now I'm going to be doing some range of motion with you. Doing flexion, extension, supination, pronation, and then abduction and adduction and circumduction. So we just finished the range of motion, and your full head to toe assessment is your collar is in within reach. Is there anything else you need before I go? Okay, so I'll be back in 30 minutes to check up on you.